Good morning and welcome to the show. I have a special guest in the studio this morning. I have JT from Dr. Nation's practice, Nation's Best Family Healthcare. JT, welcome to the show, my friend.
Thanks for having me again.
It's good to see you again.
You
It's
too.
been a while since we've had you on.
It has been.
Yeah. Now, what's your role over at Nation's Best? What do you do?
In a word, nutrition.
Uh-huh.
There's obviously I work very closely with Dr. Nation with a considerable amount of patients. I probably see between 13 and 15 a day.
Yeah.
And it's nutrition consulting, specific nutrition programs, a lot geared towards the medical aspects. We're working with patients with high blood pressure, high cholesterol, a lot of diabetic patients, type 1, type 2 diabetics, and patients with thyroid problems and things like that. We do a considerable amount of work for on the nutritional aspects and work closely with them to see if we can eliminate some of those medications or at the very least, reduce the amount that they take.
So, I guess you have, as a nutritionist, you have an advantage of working very closely with a doc who can, look at labs, see what's lacking, see what they need, see what drugs they're on, and then you can kind of do an assessment yourself and see, maybe dietarily, if that is a word, dietarily, help them out a little bit, maybe get them off those meds.
It's I've been doing this for almost 23 years now.
Wow.
And it's always been, I've always been at an arm's length from any physician, and I've worked through my client or through a patient to work with their physician back and forth on paper and emails, and it becomes very difficult to to manipulate any type of medications that they're on and make recommendations, especially if you're not working closely with that physician. The trust is not there. But it's been a blessing to be able to be there and be in the same office.
And you should always listen to your doctor. I mean, you can't, always listen to your doctor, but just being able to, just say, getting on a diet and losing weight. Just losing weight alone can, you talk about diabetes and all those other things that go along with, with being obese or being overweight.
Yeah, it all goes together, and the rate of diabetes and childhood obesity and the just obesity period in the U.S. is continuing to grow rapidly. It's not slowing down.
It is.
Childhood obesity is worse than it's ever been.
And adulthood obesity too.
It's about 2/3 of the population now.
Isn't that amazing stuff? Now, I don't want to embarrass you, but you had a little brush with celebrity a few years ago too, as a dietitian or a coach for The Biggest Loser.
I did do that for a handful of years. I lived in Tampa at the time and originally got into that with a specific family, the Muhas. And I started working with them. They go out to California, they start the show, they're able to come back home and solicit the advice of someone, and that's how
and you were that someone.
That's right.
For those of you who haven't seen it, The Biggest Loser is this competitive weight loss show where people lose tremendous amounts of weight very quickly. Not necessarily healthy, though. JT?
Not at all. That's a very, very good point that a lot of people don't think about. And there was a lady that came out that was very anorexic after the fact, and she had lost a considerable amount of weight. I think she made the cover of Time or People. And it was a pretty big deal, but they unfortunately, I think the intent's good, but losing that much weight that fast is, if you're losing more than about 2 to 2.5 pounds a week, it's not fat. Your body can't metabolize and get rid of fat that fast, period. It doesn't matter what you do or who you are, what age you are. If you're losing 5, 6, 10 pounds a week, then it's muscle and fat and water, and you're talking about blood volume and bone density and all kinds of stuff that's not good.
And things that you need to keep in your body
Very
to
much
stay
so.
healthy.
Yeah,
what is a healthy weight loss rate?
1.8 to 2.2 pounds per week is the fastest that your body can metabolize lipids. That's just fat. So if you're losing just body fat, and that's everything that we can pinch and touch on the outside, your body will also lose some visceral fat, which is you have a layer around each one of your organs to kind of cushion things. That will go too, but is on the back half.
Some of us have more cushioning than others, of course. And then the old omentum, my aching omentum. That's that big fat pad in front, isn't it?
Right.
Now that's what a lot of us guys have a problem with.
That's what I got. All the guys that I work with, that's typically what I call your thermometer. That's if you see someone that their waist is in shape, a man. Typically everything else is too, but rarely do you see a guy that has a 6-pack and is overweight somewhere else.
Yeah.
Usually doesn't happen.
So that's the bellwether.
That is.
Is that little spare tire that the
right.
guys have, and the ladies have it somewhere else. We got to run off to the local weather, and we'll talk more about that.
You got it.
On the other side of your weather, brought to you by the West Pittman Law Firm. westpittmanlawfirm.com. Welcome back to the show. I'm here with James Thompson, otherwise known as JT, the nutritionist from Dr. Roman Nation's practice up here in Lynn Haven. JT, we were talking about, how you know if you're overweight. I guess if you can pinch a little bit, you're overweight, huh? And for the ladies, it presents differently too.
It does,
I suppose.
and that's not always the easiest way to tell, but it's certainly one.
Yeah.
There's the proverbial height-weight chart that everyone loves to go to.
Yeah, if I walk into your office, what would you do to kind of evaluate me?
Yeah, that's not something that we even look at. It can be so grossly inaccurate. If you take myself, for instance, 5'9" medium bone frame guy, I should weigh between 145 and 150 pounds according to that chart.
Right.
According to the chart, I'm morbidly obese. So,
but you look like a pretty buff guy. You're working out a lot, so you've got a lot of muscle mass,
which never is taken into consideration.
Right.
So, what we do is, we can do body fat, and I do that, but typically we don't. It's not something that that we use as a bearing, body mass index and things like that. But overall, your appearance gives me everything that I need.
Yeah.
We weigh and measure every time we get together, and that's what I typically go by. We do body fat, but it's not something that we do like a skin fold analysis and things like that.
I remember the Air Force used to do stuff like that. The neck to waist ratio, they used to use that a lot. I don't know what they do now.
They still do stuff typically like that. In fact, if I was my exact stature and 22 years old, attempting to get into the military would be very tough to do.
Yeah, they tell you were too heavy.
They would. Even life insurance was a very, very difficult thing to get because of my height and weight.
Isn't that crazy? And one look at you can tell, here comes a healthy guy. That's just nuts. Now, how's the practice going? How's the whole the nutrition biz going now? You're pretty busy, huh?
Better than expected. Amazing. Yeah, it's it's good and bad. I like to get to people as quick as I can, especially when they make that decision that they're going to change and they get motivated to come in. We don't want them to wait 6 or 8 weeks. So we're trying to do our best to eliminate that, which is bringing us to opening a new office that we're looking at, a couple of locations that are going to be on the beach.
Oh, cool.
So we're not giving too much of that away until things are in stone, but that's coming. I probably see between 13 and 16 patients a day. Pretty solid.
Are you going to handle that whole workload? I mean, as things grow, you're going to get an assistant somewhere down the line, or another nutritionist on board? Or?
That's in the works right now too. I'm looking for, and have been looking for, someone to come in. I guess the best word to use would be an apprentice, if you will. No certain credentials that we need. A dietitian is good, a registered nurse is good, but someone that's willing to put the time in and learn is the biggest thing that I need.
Yeah, and what's your educational background?
Certifications in personal training and master trainer and strength and conditioning coach, sports nutrition, advanced sports nutrition. I do my degrees in physiology, but the rest are certifications and things that you do after the fact. And I'm not a dietitian; I'm a sports nutritionist.
A sports nutritionist, and therein lies the difference.
There's a very big difference, and a dietitian is much more capable of telling you the nutritional information of the foods, but not necessarily as much what to do with them.
How to fine-tune that to get you to your goal.
Right.
It's very interesting to me that you're a sports nutritionist. So if I go in to see you, you'll evaluate my diet and maybe fine-tune that for me, or create a diet for me?
Both, yes.
Okay.
When we first meet, you and I will sit down for maybe an hour and a half, and I do what's called a background history, and we talk about everything from likes and dislikes of food, to medical history, family medical history, current dietary habits, exercise habits, even what your daily activity level is at work. That, along with the blood work, which comes back to being at the office where I have access to that in front of me on the screen.
To ensure whatever diet you're doing is healthy for you. So the doc looks at it and says, okay.
And there is a pretty substantial difference in the way that I have someone eat, the frequency of their meals, the amount of carbs and the types of carbs, and the amount of protein, the amount of essential fats and things like that, based on the amount of medications that you're on, and your blood work tells a lot. That plays a very big role in how I customize the nutrition.
What about about the exercise portion of it. Would you put together an exercise regimen for me, or would you tell me, hey, just get out there 3 times a week and get your heart rate up? I mean,
there are some people that fall into that latter category. The former is ideal. I certainly put together exercise and cardiovascular exercise programs for everyone. There are some that I work with that it takes them 20 minutes to get into the office. They're not going to go do 30 minutes of cardio a day.
Oh, yeah.
So we're starting with their diet.
So you see it all. You see people from morbidly obese to maybe just a little overweight.
I do. People that are relatively healthy and not on medications to folks that have a list of 20 to 30, literally.
Just amazing stuff. JT, we've got to run. Time is always the enemy on this show, but thank you so much for coming in.
Thanks for having me. I appreciate it.
And I'm going to come down and visit you.
I'm going to hold you to it.
I mean it. I'm walking through that door, and you're going to get me back to being healthy and buff like you. And we'll be right back.
Hi, this is David Lovett, and this is your Mad Hatter Minute. Preventative maintenance is critical to keeping your vehicle running properly. Everyone knows that you need to change the engine oil and do periodic tune-ups, but no one remembers to do the timing belt. The timing belt is part of your vehicle that's located behind the timing cover, and it's not visible when you open your hood. It's a rubber belt, just like your serpentine belt or V-belts that are visible when you open your hood. Timing belts synchronize the rotation of the engine's camshaft and crankshaft so that the valves open and close at the proper strokes. Some vehicles have engines that are called interference engines, which means that the valves open and close based off the rotation of the timing belt. Pistons move up and down, valves move up and down. Should that timing belt break while you're driving, pistons continue to move, the valves drop, and there's a likelihood that the piston will strike the valve and either bend the valve or actually puncture the piston. Should your timing belt break while you're driving, it could be a very expensive repair, or it could be a complete engine replacement. Don't be surprised if the shop replacing the timing belt also recommends replacing the cam seals and the crank seals. It's best to spend a few extra dollars to have those seals replaced when you're doing the timing belt, rather than run the risk of getting oil all over the brand new timing belt and have the timing slip. Best advice is to change the engine timing belt every 60,000 miles. I am David Lovett, and that has been your Mad Hatter Minute.
Hey folks, this is Joshua Brown with Mad Hatter on 23rd Street. Is your check engine light on? If it is, text MADHAT28, that's MADHAT28, to 24247 and we'll check it for free.
Welcome back to the show. I'm here with Dr. Aaron Shores, and we're going to talk about your friend here, your spine buddy that you come here with from time to time. Now, off camera, we talked about several of the structures, and maybe you could explain briefly what this is all about and how we can keep it healthy. I mean, you always hear sit up straight or bend at the knees, and it's almost like an old wives' tale or urban legend, or is there any truth to those type of axioms?
Well, good posture is certainly important, and I think it's good that parents teach their children good posture, because certainly poor posture over the course of a lifetime can certainly lead to other problems. But the spine itself normally has a curve to it, so the normal spine is not perfectly straight, and the curve that's in the spine allows you to have some flexibility with motion and acts as a shock absorber. And maximizes mobility in certain segments of the spine. So it's normal to have some curvature, but certainly, paying attention to posture, especially when you sit at a desk or you work long periods of time. We're all guilty of sitting too long. And then the longer we sit, we have a tendency to, I think, round our shoulders out a little bit and slouch, and that's something that we just all need to remind ourselves, I think.
And over time, that could cause a problem.
It can, and certainly it can set you up for some ergonomic problems or repetitive stress injuries, depending on the line of work that you're in. So even myself, I have to make sure that I remind myself at the office to make sure that I sit up, or make sure I stretch every once in a while to try to keep some sort of a good alignment to the spine and practice what we preach.
Yeah, I want to get some baseline definitions out of you, if you don't mind.
Sure.
Now, you hear the term curvature of the spine. Now, this looks pretty curved already, and this is a healthy spine. What does curvature of the spine look like?
Well, that's a tough one. That's sometimes like saying partly cloudy. That could mean a lot of different things. But there are normal curves to the spine, like we said, which are not pathologic and are actually required, because if people lose those curves, which can happen in some conditions of the spine, that can be problematic. I think a lot of times when people refer to curvatures of the spine, they're talking about perhaps scoliosis, which is a curve that usually has a lateral curve, kind of a side-to-side curve.
So rather than this curve, which we see here as a healthy curve, it would be, looking at the spine that way, be more of like an S curve, something like that?
Yeah, it'd be more in more of an S shape.
And that would be really obvious if you're looking at a person, wouldn't it? From
In
the
extreme
outside?
cases, it certainly is very obvious. There's a specific X-ray that's required to actually make the diagnosis of a scoliosis or curvature of the spine. So we have to be careful who we say has scoliosis and who doesn't. But sometimes there are very subtle abnormalities where folks may not be aware of it, and sometimes there are certainly extreme conditions where people can have a hump on the back as a result of a curve, which can cause problems down the road as well.
Correcting something like that? I mean, it seems so major. I mean,
yeah. Well, it depends on the cause. Sometimes in adolescence, for example, some people develop what's called idiopathic scoliosis, which is a big doctor word that means you have scoliosis and we really don't know why. Those cases can sometimes be more difficult to treat. First line treatment would be bracing and physical therapy, and seeing if there's anything that we can do there, conservatively, making sure that the leg lengths are equal and there's subtle postural things that are not causing it. And then extreme cases, if it starts to affect heart or lung function, then certainly surgery can be a late stage treatment as well.
Can you live with scoliosis?
You can. Many people do live a long, happy life with scoliosis and the curvature of the spine, and other than having a curve, it doesn't cause them much problem. And certainly the converse is true too. People can have scoliosis and have lots of difficulties. So why that is sometimes a poorly understood phenomenon and varies from person to person, unfortunately.
So it may or may not be painful, and
Correct.
It may or may not have effects on, what did you call it, the kinetic chain?
The kinetic chain, yeah, the old song, the knee bone's connected to the shin bone. I think there's certainly something to that, because if your leg lengths are off or there's a discrepancy in the feet or on the other, the head and the shoulders, sometimes that can lead to other curvatures and other issues related to the spine. So if you have any questions or concerns, always, I encourage people to speak to their physicians about it, and maybe it needs further evaluation and maybe it doesn't.
Dr. Aaron Shores, thank you so much for getting us smart yet again on the spine.
Thank you.
And we'll be right back. Welcome back to the show. I'm here with Thomas Winterman, who's a clinical counselor and author of The Thrive Life. Wonderful book, gives you tips on living, and if you're in a slump, it'll help you turn your life around. If you're not, it'll keep you on track. Thomas, thanks for coming on the show.
Sure.
You've been coming on and giving us weekly tips for the week. Now, what's a good tip for this week that we can take with us?
For this week is to be aware of your musts and your shoulds.
Musts and shoulds.
We all have these sort of rules ingrained in us from when we're kids. Sometimes it's from watching our parents, sometimes it's from what we were told, the way we were brought up, but there's these ideas that we have in our heads that things must be a certain way or things should be a certain way. Things like family roles, what a husband should do, what a wife should do, what a person should do at work, what children should do, all these things that can get us stuck a little bit, that maybe somebody else has a different view. And we are being irrational about something that really isn't a big deal, and we don't know why it's so important to us.
So we're inculcated with certain roles growing up as what we think, how we should act in certain situations or what our role should be in a family or whatever.
That's right.
Now, that's a must to us, but it could be a should, right? I mean, couldn't you say, well, the dad must be the sole breadwinner? Well, maybe the dad should be the sole breadwinner, or maybe mom should be a breadwinner as well,
Right.
or there's a whole bunch of different things. That
Absolutely.
kids must have chores. Well, maybe they should have chores, or
Right.
So I kind of get what you're getting at there.
Right, and in a vacuum it's okay for one person, but the problem is the conflict between opposing shoulds or opposing musts, because then it comes down to, what do you do? How do you fix this? Well, sometimes you have to negotiate, sometimes you have to find some middle ground, And sometimes it's just a matter of being aware of your own shoulds and musts and where those come from and why they're important to you.
Some people have this ideal vision of the way things should be, and I think TV contributes to that too. I mean, you know, we should be like that family on TV. Look how happy they are.
Right.
It's not real. I want to break it to you here first. TV's not real. And so that shouldn't be your gold standard on how you should live your life.
That's right.
How do you find out your musts and should? How do you discriminate between those two?
A lot of times you find them out the hard way. You react really strongly to something that really isn't that big of a deal, and that's when you have to do some introspection, ask yourself some tough questions. Why is this so important to me? Why do I have such a hard time handling this situation? And then really examine whether or not it's actually all that important.
So I guess the Thrive thought is to know the difference?
That's right.
Okay, so know the difference between musts and shoulds. And that's all negotiable, is what I'm hearing, isn't it?
Just about everything's negotiable. That's
just about.
Just about.
As long as it's not illegal or immoral.
That's right.
Thomas Winterman, thank you so much for that Thrive tip for our week, and we'll see you next time.